For our viewers' context, you treated me for herpes zoster when I was diagnosed with it post cyclophosphamide. And doctor, even at Lupus Trust India, we've seen a lot of patients coming with herpes as the most common infection post heavy immunosuppressive treatment. And I was diagnosed also with an E. coli infection in my gut after obinutuzumab. So for these two infections that often attack or infect us lupus patients, what is it that we can do?
So herpes zoster is now coming under the group of vaccine preventable disease because now since many years we have a vaccine which we did not have in India earlier. And initial vaccines are live, but now we have recombinant or inactive vaccines also. So Shingles, which comes under that. So now we have an effective method of preventing it or reducing the risk by using the vaccination. In the childhood schedule, because we know that it starts with varicella, right? First somebody acquires chickenpox virus and then later it manifests or reactivates as the herpes zoster. So in the childhood schedule, there is also now varicella vaccine. So you can take chickenpox vaccine as primary thing to prevent chickenpox, and who has either been acquired chickenpox or who has taken chickenpox vaccine, etc. And going forward, they can go ahead with this Shingles or the inactivated herpes zoster vaccine. So that we have a good preventable source because we have a vaccine. The efficacy is in the tune of between 70 to 75%, which is quite decent for any vaccine. The E. coli infection is much more difficult because E. coli is something which is in all of us. So it is a part of our gut flora, and
I was told it's called an opportunistic or a secondary infection is what I was told.
So usually the gut flora is of E. coli and Klebsiella. So they come under this heading called as coliforms. So coliforms are what forms the fecal microbiota. So all our large colon is full of E. coli, Klebsiella and all those things. Now in a normal scenario, they are there. That's it. They don't get into us. Right? They are just a part of our gut. On a regular basis, they are excreted through the fecal matter. They help in various other requirements in the gut. So we live in harmony and helping each other at that time. But when either due to the disease or the medication, when this balance is upsetted, then a couple of these bugs which are traditionally supposed to stay in the gut, they get into us and create problems. And since they are an inherent part of us, we do not have an effective vaccine or in terms of medication, etc., to control them, which is because they are a part of our microbiota. However, one of the commonest ways they attack us is through a urinary tract infection because of the common proximity, right? Because where they are excreted through the anus and the urinary tract, etc. So one of the commonest causes of urinary tract infection is E. coli. So that is preventable by personal hygiene, right? A lot of aspects of the personal hygiene can be focused upon to prevent things like the urinary tract infection, and also in terms of the fluid intake as advised. Okay, when you have a kidney problem, you have a different set of things to manage, but otherwise holding urine for a long time, dehydration. So these are the things which again affect the bladder emptying and increases the risk of urinary tract infection. So E. coli per se cannot be eradicated because it is a part of us, but you can definitely take steps to prevent it from getting into us and creating problems, of which the most common way to enter and create problems is through a urinary tract infection, and for which we can do this basic personal hygiene measures itself, because it's a contamination and end of the day that's how it gets in. And there are some behavioral aspects like holding urine or inadequate fluid intake which affects the bladder empty.